Hello there, modern man. In this episode, we're going to talk about penile implant, how, what, and when, and also what are some of the complications related to it. Just stay tuned to the end because you're going to learn a lot of stuff and know everything about penile implant. So let's touch a little bit on kind of approach to a man that has ED that come to your office. What's the algorithm? And then talk about penile implant and the indication for that.
Sure. And I think we talked a little bit earlier about talking about the partner, making sure you check the hormones, diet, exercise, sleep, and stress, modify risk factors, making sure that there's not something, a medication that's causing the ED is important. And once you go through all those, you want to also, obviously, a detailed history, detailed physical. You want to then go through and talk about all the treatment options. But the new AUA guidelines, it's not new in 2018, but basically, it's not a stepwise approach anymore. We go Viagra, an injection, an implant. The new is shared decision-making. We give them every treatment option available. We talk about the risks and benefits of each treatment option. And then we let them choose. So if someone says, I'm not going to go with the pill, I'd like to go with the injection first, that's completely fine as long as they were counseled appropriately. But the penile implant is actually a fascinating device. So invented in 1973 here at Baylor College of Medicine. And it's been really revolutionized the way we treat men for erectile dysfunction. Essentially what it is, it's a surgery that if you think about the anatomy, the male penis has two tubes, we call those cavernosal bodies, and they're filled with muscle. And what we do is we put two balloons in them. Think of them like balloons in there, and those are called cylinders. There's a small pump in the scrotum, and then there's a small reservoir that holds normal saline behind the pubic bone typically. And when a man takes off his clothes, you would not be able to tell that he has a penile implant in. He would reach down into the scrotum, he'd press this pump, and it would induce an erection just simply by pulling normal saline out of the reservoir, putting it into the cylinders. When he finishes engaging in sexual activity, he will release the pump and all the fluid goes back. So a very, very more popular these days. It's covered by Medicare, surprisingly. So Medicare is one of the best payers for the penile implant. But if you gave questionnaires to men who've tried pills, injections, vacuums, penile implant always gets the highest satisfaction out of anything they can get and use. But it's a surgery. So some men are a little more apprehensive and saying, I'm not sure I want to do the surgery. But most men will say, I wish I'd done this sooner, because it really does make a big impact on their ability to have sex.
So who are the candidate and who are not the candidate for penile implant?
Well, there's several types of implants. There's the malleable, which is the one piece, which is always rigid, but you can bend it up and bend it down. Then there's the one I described, which is the three piece. If someone has poor manual dexterity and cannot squeeze, then you cannot put a three piece in because it will not make any sense. So that's very important. We always careful on high risk patients also, because remember, it is surgery and this is elective, and someone's a poor surgical candidate. I'm not going to put them to sleep and take that risk because they could, if they're high risk surgical candidates, you're going to be careful. But I mean, I think it's very important to also get the female partner involved in the discussion. Sometimes there are patients that say, I don't want my wife to know, I'd like to do this. I really feel it's important to have her here involved in the discussion all the way through. Those are the much better success stories.
Okay, so that's very important there. And so who are the ones that are not surgical candidate?
Well, we get anesthesia clearance if they say, look, he has a high cardiac risk and he's got significant stenosis. Unless you clear the stenosis, he's not going to be a good surgical. I mean, those are some high risk patients. We used to say that if someone had a hostile pelvis with a lot of abdominal colostomy and they had other issues, but that's not really a contraindication anymore. We can make a counter incision, we can place it safely, but the hostile pelvis is not a contraindication. Just making sure that they're a surgical candidate. I mean, I do have to put them to sleep. They do have to have anesthesia. There are some institutions, and I know in Korea, that are now doing it under local, which I have not had the experience of doing, but we still put patients to sleep under anesthesia.
And how long does the surgery take?
About 45 minutes or so.
Wow, pretty fast.
Yeah, I mean, I would say we're not trying to, it's going to be under an hour. And most patients go home the same day, and you just can't use it for 6 weeks until it heals. But after 6 weeks, then you can use the prosthesis.
And what are the complications of penile implant?
There's several. So first is that you can have an infection, and literature supports that's less than 2%, but it can get infected. If it gets infected, I have to take it out. I can't leave it in your body. But if I do take it out and I catch it early, I can salvage it by putting a new one in certain cases. The second is that you can have malfunction, and anywhere from about 10 years or so, they can malfunction, and you may have to replace the pump, which is easy to do, or replace a component, but it can malfunction. Some patients will complain of loss of penile length, but most studies show that you really don't lose significant penile length. It's just that the penis has had some atrophy over time. So patients say, I remember the penis was this large when I was 18. I say, I cannot make it as large as it was 18. I can only make it as large as it is today. So I can, whatever cylinders fit is what we can use. So I think that's another important characteristic. But you can always have some intraoperative complications such as urethral injury or bladder perforation, but those are extremely rare.
Gotcha. Okay. So essentially, you put in the two cylinder down the corpus cavernosum or the penis muscle, and then all the penis muscle atrophy around
Yes, it's just
two?
pushed to the side. It's just pushed to the side. So now instead of having the muscle expanding, you have balloons that are expanding and the muscle's still on the side. We don't take the muscle out. We just compress it against the wall.
Gotcha. Okay. And what's the satisfaction rate?
Well, it depends on what you look at. Some studies will say greater than 86%. Some will say greater than 92%. And it's for patient and partner. Partner satisfaction is important as well.
Okay. So have you looked at the partner satisfaction? Did their research with
They have.
implant as well?
They have shown that the partner satisfaction is also very high with when the male gets the penile implant.
And what's the perception from a woman perspective with the implant?
Well, I mean, it's still the patient's own natural body. It's his own natural skin. There's nothing artificial about it. And what's nice is he can maintain that erection as long as he wants. So even if he climaxes, has an orgasm, he still is able to maintain the erection. And so some patients say, look, this may even be better than when I was younger because I can have sex whenever I want, as long as I want, without any drugs, without any pills. And so it has really made a significant improvement in the relationship of many couples because of the ability to once again engage in sexual activity without a lot of barriers.
Gotcha. And they also can ejaculate as well. There's no problem with that.
No problem, no issue.
Right, because the corpus spongiosum is not touched at all.
That's right.
It's left
Well,
alone.
the corpus spongiosum is not touched at all, and that gives the rhythmic contraction of the bulb. You're right. But yes, there is still orgasm, there's still ejaculate.
What about the glands?
So the glands is important because the glands is part of the urethra, the urinary system. So you are not going to get engorgement typically of the glands, but you can put the cylinders right behind the glands up to in the mid glands. So you still get rigidity there, but you're right. In some cases, you will not see, some people still get some mild engorgement, but in most cases, you will not get engorgement of the glands.
Okay. And what age do you usually recommend this for?
It's interesting because it's really any age. I mean, you have young men who develop priapism sometimes in their 20s and 30s. It's devastating. And now they have permanent ED. And if you don't put the penile implant in early within the first 3 months, we call that they become a penile cripple. It's hard to get it in later. So sometimes because of the condition, you may treat them earlier in life. But typically most men in their late 50s, 60s is where you start seeing most of the penile implants.
Great. I'm glad we presented all that as well too. So having said that, what advice can you give to our listeners that has ED right now? What can he do right now, this moment, that will see some leverage, some improvement in his life and his sexual function?
So be proactive about prolonging your sex span. Do not wait till you have full-blown ED to start treating the issue. And you will be proactive by many of the things we discussed today. Maintain a diet that's low in inflammation, antioxidants, and a high glycemic index. So Mediterranean diet is just one example, but any diet that you can maintain to decrease the high carbohydrate intake, high inflammation will be very helpful. Second, exercise. Exercising even 40 minutes 4 times a week has been shown to significantly improve erectile function and preserve erectile function. 3, sleep. Remember, we only make testosterone when we sleep. If you're not sleeping, the T levels will go down. That's been shown. And we say that you should sleep at least 7 hours a night, preferably 8, and make sure that that sleep is good quality sleep. And mitigate your stress. Stress can significantly shut down erectile function. Now, that's easier said than done. We live in a very stressful world, and there's things going on, but you can find ways to reduce your stress. Meditation, mindfulness, find things that you enjoy doing, taking time out. It's very important to take time out for yourself and reduce your stress for your overall health and your sexual function.
Thank you so much for your wisdom, and I totally enjoy our conversation. And I know that there's lots of pearls, lots of things to unpack. I think you need to listen to this episode at least twice to unpack, because I've learned something as well. Anytime Dr. Khera says something, I'm always learning something from that as
Thank you.
well. And so I hope that you guys enjoyed this episode. Thank you, Dr. Khera,
Thank you so much.
for being with me today and sharing your wisdom. I hope you enjoyed this episode, Modern Man. It will mean the world to me if you get notifications, subscribe to the channel, and share this with somebody you think will be beneficial with. And also, know that you do not have to live with ED and suffer with ED in silence. It can be treated, it can be addressed. That's why I created the Modern Man Club. It's for you to get the resources that you need and the information that you need and the coaching from us to get you out of ED into sexual confidence. And that way you do not have to feel alone. You do not have to figure it out yourself. We have the success path for you in the Modern Man Club. It is a safe and discreet space where we get you out of erectile dysfunction into sexual confidence. Check it out, the Modern Man Club at noedman.com. So having said that, let's create a sexual revolution together where we can empower everyone to have sexual longevity for life. See you in the next episode.